Hi, everyone. My name is Evan Blake. I'm the coordinator of the Global Workers Inquest into the COVID-19 pandemic. We're joined today by Laura Miers, who has suffered from long COVID for nearly 2 years and is a prominent advocate for patients with long COVID. Laura, thank you for joining us today and for taking part in the inquest.
Thank you.
The focus of today's interview is the topic of long COVID, or post-acute sequelae of COVID-19, which is often referred to by experts as the pandemic within the pandemic. Recent studies estimate that somewhere from 10 to 30% of SARS-CoV-2 infections lead to long COVID, which can be defined as symptoms that persist for multiple months after infection. Do you want to review some of your experiences and thoughts on sort of the overall course of the pandemic, and maybe begin by sharing your initial experiences at the start of the pandemic?
Okay. So my entire household got it, all three of my children. And I thought we had the flu. I mean, I even was tweeting, oh, we have the flu, everyone's really sick. But then it never really went away. I mean, my kids had 104 fever for 2 weeks and then fevers on and off for about a year. I mean, there's all kinds of issues, they were unable to exercise or anything for a long time. My oldest child has a heart defect, so that was frightening. But he actually was the only one who was asymptomatic, believe it or not. But so I, thought I had some kind of rare disease or something. I had extremely high blood pressure. I walked into my doctor's office with my blood pressure was 190 over 120. My heart rate was 160. And they tried to prescribe me a psych drug. There was no concern. It was bizarre. And at this point, we really didn't know about the cardiovascular stuff with COVID. So I guess it made some sense because this was March or April of 2020. And I was having these bizarre episodes where I was sweating and having adrenaline rushes. It was my fight or flight was just stuck on. And so they thought I had pheochromocytoma. I was taking a phenoxybenzamine, which is a drug for this pheochromocytoma. I was on that for 3 or 4 months, and they did all the lab studies. I had my catecholamines were 4 times elevated, but I never really got any answers. I was sent to a geneticist. I had a full genetics panel run, and then I never got any answers from that either. So I'm trying to think what came next. I was diagnosed with the Chiari malformation, but that was not until 2021. And that's some kind of strange thing where your brain falls down into your spinal canal. But I've never really talked to anyone about it. It was just kind of an addition to my chart that showed up one day. So then I read that lots of long COVID patients are getting the acquired Chiari malformation. So I still don't know if that's the case.
This was all sort of mostly unfolding in April, May 2020.
Okay, yeah. So yes, April and May, I thought I was dying. I mean, I had lost 40 pounds. I have the tumors. These tumors started showing up. Okay, I've got them in the base of my skull. They're in my neck. I have one in the front of my neck. I had a pre-existing, one small pre-existing tumor that quadrupled in size. I started getting them. All of my lymph nodes were enlarged, head, neck, groin. And I was getting just lumps were showing up everywhere. And so I went and saw a head and neck oncologist, and he thought that they didn't need to be biopsied. He kept telling me, if you were my sister, I wouldn't recommend biopsy. And I was like, okay. So they kept spreading and getting larger. I did go, I had a biopsy consult at the end. It was, I think, fall 2021. That was the last time I went to the doctor because this man had no mask on. I couldn't handle it. No one was masking. I'm supposed to have a biopsy at some point, but I don't feel safe getting care here. It's not, it's really, there's just the precautions are really subpar.
You were in New York at the time? This is
all in Rochester. Yeah. And I'm on managed care, Medicaid managed care. So I can't leave the area for any kind of care or treatment, supposedly. So that was odd. I never really got any answers. I went back to my primary care doctor. I'd lost 40 pounds. I have tumors. I had very strange high blood pressure, hypertension. I have heart damage. I went to the cardiologist and was diagnosed with heart changes. He, of course, since COVID is not in my chart because I never had a positive test, getting sick February, March of 2020, he was like, well, you have heart damage from your hypertension. And I'm like, well, I never had hypertension before 2020, that's the COVID, but the COVID isn't in my chart. So there's, I feel like I have this laundry list of issues that of course started after COVID, but there's no attributing it to this virus I got because there was no positive test. And all these people who have just had Omicron and the rapid tests are going to find they're going to have the same problem because long COVID clinics require PCR testing, proof, that you have had the virus. And I think a lot of that is by design. I really do. I think it's going to, when shifting the burden onto the individual was always going to end up like this. We're not counting long COVID. Nobody has any idea how many people actually have it. It just made it much harder for people to get care, I think, in my opinion.
This issue is actually really critical, what you were just raising. Only 1% to 3% of cases in March 2020 were actually recorded. They only that many people were tested, meaning that 97 to 99% of people who caught COVID during the initial surge, like yourself, never got a positive test because it wasn't available outside of hospitals until May 2020. And I just wanted to read a quote and hear your thoughts. On May 14, 2020, then U.S. President Donald Trump stated, quote, "When you test, you have a case. When you test, you find something is wrong with people. If we didn't do any testing, we would have very few cases." Then he later added, "Could be that testing's frankly overrated. Maybe it is overrated," end quote. And you touched on this a bit, but maybe could you speak a bit more? What does it mean for the 97 to 99% of people who didn't get COVID tests during this time? How does it impact your access to treatment?
There's a lot of people who are finding themselves with all kinds of health problems who probably aren't attributing it to prior COVID infections, especially if they got it early and it was, mild or asymptomatic case. And we also know that the virus persists in all these organs for who knows how long. I think I read recently, like at least 7 months. So it's going to continue causing damage and problems, and people may not even know. As far as access, like in my area of Western New York, there are no long COVID clinics. People really are not very aware of it. When I was treated as if it was a huge, rare disease, like there's no way you could have long COVID. I was, of course, diagnosed with a very rare disease that affects only 1 in a million people because the symptoms mimicked COVID. And it was that didn't have that. It was COVID. So I think it's going to be it's going to be a huge problem. I bristle when I hear people talk about, oh, it's over, we're going back to normal, because the late effects are going to be so bad. People are going to prematurely die. Their qualities of life are going to be significantly impacted, especially if they aren't getting any kind of treatment. There's no long COVID clinics in Western New York. The ones that are in the city, usually require a positive test. People may not even know that they had it and are suddenly getting all of these, bizarre new health problems that they aren't attributing to COVID. And I hate the fact that the data really isn't reliable because we aren't really knowing how many people are even getting sick because of there's so much widespread rapid testing and everything. But it's absolutely been a huge barrier to getting care, not having a positive test.
Yeah.
And I don't know, I think it's going to continue with Omicron because people aren't going to have I think a rapid test is fine, and they wrote it out at home and everything's going to be great. And people also aren't aware of the lull. There's a lull after the initial infection before long COVID symptoms set in a lot of the time. It can be even months later that symptoms hit. And so, I know I saw at least 12 to 13 specialists between 2020 and 2021. So much testing, so much lab work. I was at the doctor all the time. Not really, and it took me months to even realize this was probably COVID related. I feel like the government is trying to not be accountable at all, avoid accountability at all costs. And the burden has just been shifted onto the individual, which is breathtaking. I don't even know, it worries me so much because people are just silently dropping out of society.
Yeah. No, I think these are critical points. I think it's critical to always stress how severe this virus, how dangerous this virus is, and sort of the range of symptoms that people can experience. Just look at this. This was from a study that was published in Nature last August, which found it was sort of a meta-analysis of a number of studies on long COVID up to that point. They found that 80% of all people who had COVID experienced at least one symptom. I believe this was 2 weeks or more after infection, and the most common is fatigue. You can see at the top, just this whole gamut of symptoms that people have experienced, basically affecting almost every organ in the body, including the brain, the heart, the lungs, the immune system, kidneys. It's just a massive, multi-system, disease. And I spoke to a colleague of mine before the interview, Dr. Benjamin Mateus. He's one of our main writers on the pandemic at the WSWS. He noted that officially there's been almost 500 million cases worldwide, but due to severe under-testing, inadequate resources throughout much of the world, in reality, it's probably at this point at least a third or half of the world population has been infected at least once. And so if you take the low range of 10%. Suffering from long COVID, you're talking about, if it's 3 billion, that would be 300 million people throughout the world that are experiencing at least one of these symptoms, but it's often multiple symptoms. And, that you're talking about tens of millions, hundreds of millions of people suffering damage to the brain, to the heart, the lungs, kidneys, just all these different organs, which really, these organs protect us. They keep us safe and ensure that we live a long life. And I think when you get infected, you don't think that this will have this massive long-term impact on your ability to function. So I was wondering maybe if you could speak a bit further about the symptoms that you've experienced. You spoke on this a bit, but sort of how they've changed over time, and maybe others that you've others that concern you, that you've read about, that you've seen on Twitter. I saw a post recently, it was sort of an anecdote, but Diana, I'm forgetting her last name, but she's an advocate she tweeted that, two of her friends have been diagnosed with early onset Alzheimer's in their 40s. So maybe you could sort of speak a bit more on these issues.
That very much concerns me because I've had a lot of cognitive issues. And oddly, when I first got sick, maybe 3 months after, I noticed something was wrong with my brain. I did lose I couldn't smell or taste. And it was complete. It's unlike anything I've ever experienced. It's not like, oh, it's a cold, they're dulled, you can't smell or taste anything, which is brain damage, of course. So after I noticed that I was getting lost while driving, I usually have a keen sense of direction, but I couldn't find where I was going. I would always play Xbox with my kids, and I forgot how to operate the Xbox controllers. Like I forgot the maps in our games that we played together. It was terrifying. I've never experienced anything like this. Like I really couldn't read. It was like a sensory overload, which I hear is also a symptom of the ME, the myalgic encephalomyelitis, which one half of long COVID patients meet the diagnostic criteria for that. And that's it's a debilitating illness, but the brain stuff is very strange. So I think it took maybe 6 to 9 months for that to get better. It improved, and I was better with directions and things. But now in year 2, I'm forgetting words. I'm having trouble word finding. I forget if I've eaten. I forget, I forget important things. And I mean, I feel like something's definitely not right. I have not seen a neurologist, but I think I definitely need to. I also, I mean, I had I couldn't, sense of hunger and thirst was gone. Like that's why I lost so much weight, which is dysautonomia. And I didn't realize that. And once I realized that I was literally forgetting to eat or drink because I wasn't being triggered appropriately, I was able to put on some weight, but I had to set alarms to remind myself to eat and drink, which is crazy, right? Like this is not normal. But yeah, the cognitive stuff is definitely scary. And I think that's going to definitely, Anthony Leonardi wrote and somebody WSWS interviewed him, that one about talking about the beta amyloid or Lewy bodies, beta amyloid deposits and things like these things are going to come back to haunt us. This is not something, I think of polio a lot. I never knew that 95% of polio victims had no idea that they were sick. They were mostly asymptomatic until, decades later when post-polio syndrome hit. I think it's going to be, similar to that probably, because it's interesting how the symptoms evolve. The symptoms I have now are completely different from the ones that I started out with. I am on medication that manages my hypertension and things, but everything's kind of evolving, and I don't know. There is a chart I've seen that's similar to the one that you put up. That's actually, I think Hannah Davis is the one that I saw share it. That it has over time, like it shows which symptoms you begin with and where, and then over time how they change. So I've definitely noticed that. I also have a lot of eye and ear involvement. I was diagnosed with meibomian gland dysfunction in my eyes. So that's apparently capped glands or something. I have these weird little growths in my ear. I still have the tumors. Who knows what they are? But clearly this is not good.
There is a lot more research into long COVID now. I think, especially in the first year. I mean, that was the term gaslighting. We've interviewed a number of people that have, as you described, just being told that they don't have a condition. They're, that it couldn't be COVID. It's, that it's sort of psychosomatic. And it's sort of basically dismissing their real concerns. And so I think that is starting to shift, but it's also it's sort of far too late. I mean, we're at a point where so many people have become infected, and it's just, I think the long-term sort of societal implications are really horrendous. In that interview, Dr. Leonardi, points to the potential if this, there's these initial anecdotes about early onset Alzheimer's, but if you're talking about how even if it's just 1% of all COVID patients develop neurological problems, that's you're talking about 10 million 10 to 30 million people around the world, and it's society was all the healthcare system was already not in a state to handle it was already had been systematically defunded for decades before the pandemic. Now it's basically in a state of collapse at this point.
Right.
So it's just, it's horrible, and I think really speaks to the sort of the way in which the pandemic has been, a social crime, committed against
Mhm.
the working class.
Yeah.
So maybe we can get into some of the more political aspects. And do you want to speak on sort of your thoughts on the response of the Trump administration? Maybe if there's something specific that you'd want to take up, but maybe I guess just on this issue, the whole herd immunity strategy, that their conception was everyone would get infected once, or they
Right.
would. It was based on this total pseudoscience, and essentially a sort of social Darwinist conception, survival of the fittest,
Right.
and they would just let the virus rip through society, and that would be it.
Mhm.
Um,
Right.
and so, yeah, maybe do you want to speak a bit on that and sort of,
Well, I say a lot, like I feel as if the virus, obviously is mutating and changing, but it's still COVID, but our perception has changed so dramatically, from 2020 and the Trump administration. People, media covered it appropriately, they covered it critically. We got, lengthy in-depth articles. It was front page news. Everyone, feared it as they should. But now it has been sold to us as, this harmless little, no, it's even a vaccine itself, this crazy,
right,
crazy. It's crazy. It really is crazy. And I don't understand. I mean, and this has been over time. I've noticed that media kind of works in these cycles where, every 3 months or so, we have to do it's over, let's get back to normal stuff. And it's illogical. It doesn't make any sense. And the whole one and done aspect seems to be hanging around too. People keep thinking that you're going to get it once and that's it. But
yeah,
I read an article in The Guardian, I think it was, about a UK nurse who was on her fourth round of COVID. How is that sustainable? I think even like Fox's Neil Cavuto or whatever his name is, he was in the ICU this time around for his second infection. He's fully vaccinated and boosted. Um, you know, I think it's just going to continue infecting people. And I don't understand, where's the plan? There doesn't really seem to be a plan. We're just kind of flying by the seat of our pants.
yeah,
Um, I don't understand it. It doesn't really seem to make any sense, because if we're just infecting everyone and not building any type of immunity, what is the point? I mean, the point is, of course, to make sure profits are managed and everything, I guess, but it's disgusting. It's disgusting.
yeah,
I was very disappointed with the Biden administration, with their response, because what are we doing here? I've noticed that there's this trend to get less and less data. There's data recalculations and all of these things going on. So we really don't even know what's happening. I mean, it's like
right,
they're manipulating data and the narrative to fit the narrative of back to normal, whether we like it or not, whether it's the truth or not. And I feel people are being used. People are being taken advantage of. People don't have the money to take care of themselves with all of these chronic illnesses that they're going to get after their third round of COVID, or whatever. I don't understand what's happening.
yeah. No, I think those are critical points, and just the way that the Biden administration has adopted these basic talking points of the far right, of the Great
Yes.
Barrington Declaration, the Trump
Oh,
administration.
yeah.
This was an early talking point of the far right, that people were being hospitalized with COVID and not for
Oh,
COVID.
yeah.
And now
Mm.
that's been adopted by the Democratic Party. Started in New York with Kathy Hochul, but now it's
Mhm.
been picked up by the CDC. Rochelle Walensky and the Biden
Yeah.
administration are promoting this. But then I think the way we've really analyzed the Omicron surge in particular, there's been just the complete abandonment of all mitigation measures, and this basically coming together of the herd immunity strategy with with the mitigationist strategy, and doing so under the framework that COVID now is endemic. and that it's just, it's just a harmless virus that, as you said, once you're infected, then you'll have antibodies, you'll be immune for perpetuity, and it's basically nothing to worry about. Or if you've been vaccinated, that you can basically go on with your life, and if you are infected, it won't be severe. And just it's also, as you said, it's bound up with this cover up of data. There was a last week it was revealed that the CDC has been withholding data on breakthrough infections for young adults for over a year. And in early the WSWS is the only outlet that's really covered this, but on February 2nd, the HHS stopped collecting daily reports from hospitals, which was a major data source that was established at the beginning of the pandemic. And this includes data on daily deaths, how many deaths took place at the hospital the day prior. And so it's just a huge effort to manipulate the data to basically to end all tracking of the pandemic, which they haven't completely done that in the US, but they in the UK they've announced that they're planning to do that, I believe, by May. In Sweden they've stopped all broad-based testing, and that's what's coming in the US. And it is, as you said, it's horrific. So maybe, I think it'd be good to maybe go back a little bit and sort of review some of your experiences and sort of your thoughts on different episodes in the Biden administration. I guess, throughout his campaign in 2020, Biden repeatedly said that he would follow the science and fight to stop the pandemic. There was a presidential debate on October 22nd, 2020, when Biden criticized Trump for his response to the pandemic. He pointed to the fact that 220,000 Americans had died from COVID-19 up until then. And he said, quote, "Anyone who's responsible for that many deaths should not remain as president of the United States of America," end quote. Today, the death toll is over 4 times that figure, and it's quickly approaching 1 million. So maybe could you comment a bit more on sort of your experiences over the past year, and your thoughts on the Biden administration's response and sort of how it developed over time? I know, May 13 was a critical turning point with the lifting of the mask mandates.
Okay, well, May, I call it the great unmasking. It was crazy. I will never forget, and I tweet this article all the time because it was like May, the end of May sometime. We learned that immunocompromised people were fully vaccinated and dying of COVID. And that was already happening when we unmasked. And it's horrific. It's such devaluing people's lives, that's when around that time is when I had that biopsy consult, and I went in and this doctor had no mask on, and it's just like a punch in the gut. You're seeing other countries that have full PPE, really taking precautions. And here we are with Delta rolling in, with unmasked providers. I have not been back to the doctor. I've had a few remote visits, but I can't stand the thought of, being surrounded by and the surgical masks. It's like we understand that these do not prevent infection. We need N95s and things, but now we're unmasking again. And it doesn't make any sense. Immunocompromised and disabled people are being held hostage, essentially. And there's all these false choices presented, like, oh, well, you can just stay home then, or, you don't have to participate in society. It's fine, or the alternative is I'll sacrifice my life so, we can live normally or whatever. Like, none of this just doesn't make sense. Masks are literally the bare minimum. And Walensky the other day mentioned masks are the scarlet letter of the pandemic, which I cannot understand why. And you're right, they absolutely sound like conservatives. Like they have met on COVID, and I think that was also kind of like media has been deliberately doing these campaigns to shift public opinion, shift manufacturer consent. And if you listen, it very much sounds like exactly a conservative stance on COVID from a couple of years ago. I mean, we're doing the same things, making the same mistakes over and over again.
I think those are critical points. I mean, as you said, last week, Walensky stated, quote, "We want to give people a break from things like mask wearing," end quote. And it's just, I mean, it's another of these talking points of the far right and the right wing. And I thought her speech, I mean, this is sort of returning to, as you said, the great unmasking. On May 13, 2021, she proclaimed that vaccinated people could take off their masks. And as you said, I think this was a really sort of critical turning point in the pandemic. It triggered the ending of mask mandates, in almost every state across the U.S. And really set the stage for the disastrous surge of the Delta variant, which began in July. I pulled the numbers on May 13 when Walensky said this. There were nearly 39,000 official infections that day. So it's not like we were,
Right.
getting to zero, or even, it was still pretty high. But, within 3 months on August 13, there were nearly 166,000 cases that day. So maybe if you want to speak a bit more on sort of, what went through your mind when you found out about this, sort of on May 13 and sort of the weeks that followed, because this triggered, I remember it, you would go into stores and gradually more and more people would be taking off their masks. And 6 days before that, actually, it was on a Friday on May 7th, the CDC had officially acknowledged that COVID could spread through aerosols. They didn't, I don't think they referred to it as an airborne virus, but they basically silently updated their guidelines and acknowledged that it could spread, or that it does spread through aerosols. And then within a week, they go on with the great unmasking.
Right.
So,
I mean, it seems like these thinly veiled herd immunity attempts. I mean, if you want my honest opinion, I really thought I think they thought that once again, everyone would get infected and then it's just going to quietly disappear into the night. But that didn't happen. And what's so weird is we heard Omicron is mild. It's mild, it's not going to harm you. And then there were more deaths than the Delta wave. So, there's these facts, but we're just not acknowledging them whatsoever. I think now what I'm noticing is it seems like there's corporations and everyone get in front of a new variant and set the narrative, and then we bend over backwards to try to match it, if that makes sense. Like we heard the Omicron is mild narrative immediately right out of the gate, and that's what stuck, and everyone thought that was the truth, and then there were more deaths than Delta. So I mean, it really it doesn't make sense. When the great unmasking round 1 occurred in May, that was kind of like the last time my kids hung out with friends and things, because everyone went back to normal. That was kind of the cue to return to normal, have parties, I feel like that was kind of a turning point, especially for immunocompromised and vulnerable people. That was kind of like a loss of hope. It was, oh, this is where we're going, oh, great. And here we are again, repeating identical mistakes. And you have to wonder, is it deliberate? I mean, how can they not know? And why are they describing masks like a punishment? Like, I don't understand describing public health protections as like punishments. Like, that doesn't even make sense. That's not, it's very political. It really, I don't know. I don't like it. And it kind of smacks of like xenophobia too. I've noticed there's, media is really coming down on the zero COVID countries like that are struggling or regions. And I think some countries have been masking for decades, that's like a normal part of life. Why can't we do that? Like, it doesn't make any sense. It feels like there's agendas, the agenda has nothing to do with public health.
No, absolutely. I think, and I think it raises the sort of the fundamental class issues involved. And, really the fact that, these policies are now being implemented by the Democrats, in California. Just last week, they released what they've called their endemic plan. And just this wave of lifting of all mitigation measures, mask mandates in Democrat-led states, and I think it speaks to the fact that the Democrats, as with the Republicans, represent the capitalist class. They represent different factions. They're more tied to Wall Street in particular, and the the intelligence agencies. But fundamentally, they are hostile to the working class. They and I think it really came through sharply in Walensky's comments in early January, where she explicitly said, when she was asked, this question about, who is COVID impacting primarily, and she said that it's a good thing that it's impacting people who already had pre-existing conditions, and it was essentially a eugenicist position.
Right.
But I think this sort of these economic questions are really critical. There was actually, I wanted to read a quote from Eric Adams, who's the Democratic mayor of New York City. Last week, he said at a press conference, quote, "I see myself not in crises. I see myself out of crisis. The best thing we can do to deal with COVID is get back to work." He added, "New Yorkers did their job, vaccinated, boosters, taking testing. Now I need them to do one more job, go back to their job," end quote. And so it's just, incredibly blunt. And, he earlier, right after he was inaugurated, he talked about, feeding the financial ecosystem. This is in New York City, home to more billionaires than any other city in the world. And the center of Wall Street. I think these sort of class issues are really central to understanding it, and I think it's also connected to the school reopening campaign, which really kicked into full high gear under Biden. So maybe do you want to speak a bit on your thoughts on these issues and sort of the class questions involved?
Right. Well, I mean, we know which groups are disproportionately affected. It almost feels like I read a quote. I can't remember who it was from, but they anticipated everyone will be flooding back into the workforce in February after they've exhausted their life savings. And it just feels like they're completely out of touch with what's really going on. I mean, how are sick people supposed to go back to work? I mean, starving people, and they ended the child tax credit and have just squeezed people to a point that, I mean, people are going to break. There's only so far you can push people. And I don't see, like, I'm definitely better than I was when I first got sick, but I slept for 4 days at a time. Not waking up only to go to the bathroom or something. Like, there is no way that I could work. I could not work today, even being better. This is not, a lot of people aren't recovering. And so I don't understand. It feels like they don't quite understand long COVID, and it feels like they aren't understanding what's actually happening in the real world with the working and middle classes. And it just feels like they're just trying to abandon people and force them back to work, regardless. But I just don't think that's sustainable. You can't, especially with all of these reinfections. And I'm kind of unclear on the booster schedule and everything. It feels like there's really not a plan going forward. I don't understand how people are going to survive. I don't understand that child tax credit particularly. Why did that happen? Why did they remove that? And then you've got all these and back to work. I don't know. There feels like these massive holes in the plan. Does that make sense?
Yeah. Well, no, I mean, I think, it's capitalism. Capitalism
Right,
is, sort of
right,
based on, the anarchy of the market. Everything is
mhm,
dictated by, the needs of the capitalists, the need
right,
to produce profit.
mhm,
And so that, I mean, if that's why they cut off the child tax credit,
right,
because they don't want any social supports for workers, I mean, that was sort of one of the keystones of the Biden administration was ending the extended federal unemployment benefits, ending the eviction moratorium. They put all these financial and economic pressures on on the working class to one send their kids back to school
mhm,
in order then to go back to work in order to go back to work themselves.
right,
And I think I was wondering if you could maybe share your experience, and your thoughts on the school reopening drive, because that was
mhm,
really, Biden's sort of central domestic policy when he came to office. He said it multiple times, after being
mhm,
elected, that he would get the schools open within his first 100 days. And then it started with Chicago. They set a precedent there. Randy Weingarten was
mhm.
spending 15 hours a day on the phone with
Mhm.
the White House, the CDC. So maybe if you could, yeah, share your thoughts on the whole school reopening campaign and how it's, connected to the broader pandemic policies.
Well, what is it? I think 2.9 million children were infected just over the last 4 weeks.
Yeah.
That was the latest American Academy of Pediatrics numbers. And I think now we're up to like 12 million children in total. And I believe that's several million increase over when schools reopened. I don't have the numbers in front of me, but um, I don't understand what people are thinking. I understand that people have no choice but to send their kids to school, but it seems like there was really no effort to make them safe, or, it's just we're just throwing kids in to get infected. And the like diabetes, God, the pediatric diabetes diagnoses doubled since the pandemic began. And I don't, okay, so I think what we're for 1,436 American children have died of COVID thus far. But the survivors are going to have a lifetime of complications. I think they did say 10% of children get long COVID. We still don't even know what late effects are going to be lying in wait for us later. Um, I think it's horrific. It's horrific that people are being forced into these impossible situations. I'm very fortunate that I've been able to keep my kids home. We're doing like an online homeschooling type of situation because our district quit offering a remote option right after the great unmasking. This year
Yeah.
there was nothing, so we were just left out. High vulnerable, high risk families just have no choice. There is no choice. So that was really disappointing. There's just no accommodation. It's like we're pretending that disabled and immunocompromised people just don't exist. Like there's no need to accommodate them in society, which is crazy. But even just for kids who don't have issues, this is brutally unfair to them to force infection after infection. I will never forget this family, Arkansas family. I think this article came out maybe in May of last year, but their child he was 5, had COVID twice and their family's $100,000 in medical debt now because he
Mm.
was hospitalized both times. And I think about just how many children this is affecting, and we're all just pretending that it's fine. And I don't get it. I think it's almost like these false narratives stick. Like in the beginning, we heard COVID doesn't affect kids, and that's what stuck. And we heard Omicron was mild, and that's what stuck. And even in the face of facts, people are not acknowledging reality.
Yeah. Well, I think as you said, earlier, I think a lot, the media really bears, the media and the political
Mhm.
establishment bear central responsibility. these policies are being enforced by the Democratic Party. The most sort of herd immunity approach is obviously being taken in the Republican states, where they've banned, even limited mask usage. But as I said, this is the central sort of platform of the Biden administration, working with the unions. I mean, the teachers unions have really been, and all the unions have really facilitated the reopening campaign. First under Trump, but then under Biden as well. And also there's the sort of politicization of the CDC. In early 2021, they changed their guidelines multiple times to basically recommend that schools reopen. Then they arbitrarily changed the social distancing from 6 feet to 3 feet, basically to pack more kids into classrooms. And on February 16, 2021, Biden, the lying came directly from the top. Biden lied to a second grader on CNN. They were having a town hall, and on national television, he said, quote, "You're not likely to be able to be exposed to something and spread it to mommy or daddy. Kids don't get COVID very often. It's unusual for that to happen," end quote.
The coronavirus is very real and very scary, and it's especially scary for children who may or may not understand. My children, Layla, 8 here, and my son, Mateo, 7 at home, often ask if they will catch COVID, and if they do, will they die?
Well, what's your first name?
Layla.
Layla, beautiful name. You're the safest group of people in the whole world, number one. Number two, you're not likely to be able to be exposed to something and spread it to mommy or daddy. And it's not likely mommy and daddy are able to spread it to you either. So I wouldn't worry about it, baby, I promise you.
And so, that was just over a year ago. And they've done nothing to educate society on the pandemic. And it's all, it's sort of rooted in this, these economic factors that, the economic imperative of, sending parents back to work. We spoke on this before, but I was wondering if you could comment on the sort of right-wing attacks that you've come under on, wearing on mask wearing, and sort of what when that started, and sort of how it developed over time. Not just masks, but also, elastomeric respirators.
Right. It's very strange. There's literally targeted attacks for people wearing elastomerics. I've noticed, especially women. I have had to field just thousands of comments and attacks. And I'm sorry, but I think that it's coordinated. I mean, it definitely feels as if there's a coordinated aspect to it, because there's they all repeat the same talking points, and need to insinuate that you must be mentally ill if you're masking, or especially if you're wearing an elastomeric. And I think this is like a corporate funded effort to attack masking, but especially elastomerics, because they're a visual reminder that something is wrong. But if everyone wore elastomerics, we wouldn't probably be in this situation, I mean, they're very effective. If healthcare workers all wore elastomerics, I would tap dance my way into the hospital and go get care. I mean, that I would feel safe. That would be great. So I hate that they're attacked, but, I think I'll never forget, like, the New York Times article talking about the service class are the ones that are still masking. This was last year. It was grotesque, but I think masking has been unfairly attacked for sure, but people really aren't educated about elastomerics either. And it seems like there's no interest in really educating people on the part of the government or the CDC, because I don't think businesses want people masking. I think that interferes with, the whole visual and narrative that everything's great. But it doesn't make any sense, because we have these tools that we could use.
There was a report in October 2021, which found that by that point, the billionaires in the US had increased their wealth by $2.1 trillion, or 70%, just since the start of the pandemic. Then last month, there was another report by Oxfam, which noted that the incomes and this was a global report, so the incomes worldwide for the bottom 99% actually have fallen during the pandemic, while the wealth of the top 10 wealthiest people in the world have doubled. And, over every 26 hours since the pandemic began, there's been a new billionaire created, and over 160 million people have been pushed into poverty since the start of the pandemic.
I think it's like a massive ongoing wealth transfer at this point. I think it has absolutely nothing to do with human life. I don't think they care. I think they are never going to give up this type of profits. 70%. How else would you ever, have that kind of an increase in profits? Why would they want to let that go? It seems that this is kind of the end game goal, that they just want to continue. I mean, we're based on endless growth, and here's this great way to keep growing profit, but just keep the disease circulating, keep the virus going. It's awful. And with and being that there's nobody's really trying to tackle it in any way. No one's addressing it in our country, at least, we're just pretending it's not happening. I read that home ownership is just a pipe dream now for most people. And like that, all of these inflation, all these problems, people are being squeezed just from every direction. And I don't think it's sustainable. Like, it really does not seem that we can continue this way. I don't know what's going to happen to people. I mean, we're missing over 2 million people from the workforce just from long COVID alone. There's no effort to help those people. There was an article in Bloomberg, I think it was August, that said if even 10% of the then 34 million people who had COVID at that time, now it's double, were to get long COVID, then the system would collapse. Then we never heard about it again, and now over 80 million people have had COVID. If, 10 to 30% of those people now have long COVID and try to apply for disability, they can't, it's just not going to happen. So I think we're like deliberately not counting it. It seems like, to me, from my point of view, it seems like we're only focusing on profits and only focusing on enriching, the 1% at this point, and people who fall out of society or fall into poverty are just collateral damage. That's my viewpoint, at least. Because if that weren't the case, you would think we would be trying to do something about it. But I mean, it almost seems like the coexisting with COVID movement is a forever pandemic,
Yeah, there's a figure, he's the White House COVID response, the head of the COVID response team, Jeff Zients. I don't know if you followed him. Yeah, he himself was a pandemic profiteer in 2020, and his wealth grew somewhere between $10.4 million and $28 million in 2020. Wow. He's the richest person in the Biden administration, and his net worth is estimated to be somewhere from $89.3 to $442.8 million. And he is the person in charge. Basically, after Biden, he's the only other person in the Biden administration who can use the Defense Production Act to compel companies to, switch their production to provide for the pandemic. He refused to use those powers basically throughout the past year until the Omicron surge, and there was immense opposition building, and so they sent out 4 rapid tests to everyone, and I believe 2 masks per person. And now he meets weekly with the governors, and was basically is the sort of he's at the center of the Biden administration's response, and I think it really speaks to these class issues. made his money on Wall Street in finance, and has been heading the response. He has no background in public health or medicine. So are you familiar with him? And maybe if you could comment a bit on sort of what that says.
I did not realize he was an early pandemic profiteer. Very interesting. Well, that certainly makes sense then, why he's in charge. I mean, it doesn't make sense, but it does, because this is all about profit. It's all about supporting corporations and businesses at the expense of human life. It makes no sense that we would have this man in charge of our pandemic response whatsoever. But I think we're going to expect more of the same. I don't know what it's going to take to make things change at this point. It is an every man for himself style situation right now. And I don't think people are being protected in any meaningful manner. And I don't think they're going to be. I think like the Koch network, that whole involvement really worries me with they have their hands in all of this too. And we're not going to be able to stay healthy or protect ourselves at this point. Corporations aren't going to allow it. It benefits them if this continues.
No, absolutely. I was wondering if you could speak a bit on your thoughts on the elimination strategy or zero COVID, because that's something that we've been advocating really since the start of the pandemic, is for every country to implement basically every public health measure that's available to stop viral transmission and gradually bring cases down to zero.
Right.
And I think this was done most effectively in China, which was the first, major country to implement this policy. But then it was replicated in, many other countries in the Asia Pacific region, New Zealand, parts of Australia, in Singapore, even in, more impoverished countries like Vietnam. And this was basically rejected throughout, much of the, the West, and much of the rest of the world. And there was this, as we discussed earlier, there was the herd immunity strategy implemented by, Trump in the US, Bolsonaro in Brazil, Boris Johnson in the UK, Narendra Modi in India, and other world leaders in 2020, which accounted for, the vast majority of deaths, during that time. But then there was this mitigationist approach of Biden and other sort of more, quote unquote, liberal politicians. Who, they basically argued that, the vaccines were sort of a magic bullet, and they sort of promoted mask usage. There was this unmasking, but then they started to recommend them again in the summer. But it was always something of a pretense. And I think that has basically, as we've been discussing, collapsed. There's been a coming together of the herd immunity and mitigationist strategy. And so I guess I was wondering if you could share your thoughts on elimination and why we have to fight for zero COVID. And, if you're, because I think that's really the way forward. And answer, to your question is sort of what has to be done. I think we have to really build, a mass movement of the working class, united globally, fighting to actually end the pandemic. And, it's not going to come from the powers that be.
Well, I've been a zero COVID proponent from the very beginning. I was in a little group of people that we met weekly remotely for zero COVID New York. And then that kind of trickled away when the whole unmasking thing happened. But, I've noticed that the media is attacking zero COVID, is very invested in attacking the zero COVID strategies, and has even been, blaming zero COVID measures for surges in Hong Kong and things, which is so disingenuous because obviously it's the virus that's doing that. Elimination seems like the only way forward, but, there's just so many countries seem to be coordinated in this. Let's just let it rip. I would absolutely support more elimination measures. And, I've heard people say it really wouldn't even take that long. If the whole world just got together and, did this, paid people to stay home, we could actually make a dent in it. But it seems like the United States particularly has been just keeping it going with this, these let it rip strategies on and off. But yeah, I mean, I definitely think elimination is the only way forward. We absolutely cannot coexist with this virus. I mean, it's still mutating. It's becoming more deadly, more transmissible each time around. I don't understand what people think is going to happen. It's like wishful thinking is determining policy these days. It doesn't. But no, I absolutely think zero COVID is the way to go. And I think someday we'll all agree on that. But, right now we can't see it, I guess.
And I think, as you said, the media attacks on, China's zero, in particular China, it's sort of this, every day there's some, new op-ed in the Times or the Post, vilifying China. It really sort of ramped up to a fever pitch during the Olympics. But, I think the aspect of, the paid lockdowns is, sort of one of the centers of their opposition, but really, it's bound up with the sort of the whole production process under capitalism. Can't tolerate any interruption to the production of surplus value, and they have to keep workers at the plants. They have to ensure that production is not stopped, that the surplus value continues to be produced. And so the concept of having, as you said, it would be temporary. It would not take that long. But even the estimated 6 to 8 weeks, or potentially a bit longer, no more than 3 months, that is not, it's unacceptable to the ruling class, and they they're just vociferously opposed to that. And so so I think it is a class question, and it has to be, we have to build a mass movement fighting for elimination, and it has to come from the workers themselves, who as you said are bearing the brunt of this, are being infected, facing long-term debilitation. But really that's the only way forward. That it can't, it's not going to come from the Republicans or the Democrats, and because they serve the ruling class that depends upon capitalist production.
And I mean, I'm thinking like a medical debt, and just, I think I read recently just of all of the income long COVID patients have lost, and just how much money it costs to get treatment and care and do all of these things to survive. There's just no way that we can, millions and millions of Americans are going to be able to afford that, and with each reinfection, I imagine the risk of long COVID, grows, and eventually, you're probably going to end up with long COVID symptoms. It's just so expensive. Like when the coexisting with COVID thing, I always thought was only just to shift the burden onto the individual, and particularly the financial burden. We had COVID coverage, people's care was covered before, and that's no longer the case. And I mean, people are going bankrupt and homeless just after, becoming homeless after, one infection. How is that sustainable 2 or 3 times a year in perpetuity? It's not.
No, absolutely. I guess just as a final question, I was wondering, we on the WSWS, we've been covering the danger of war, the really ramped up escalation of the, and really stressing that this is coming from the imperialist powers, driven by the US, which leads NATO. There's been, really a decades-long, expansion of NATO, eastward, basically to encircle Russia, and there's we don't support the Putin regime, which harkens back to they essentially present sort of great Russian chauvinism, extreme Russian nationalism, but the real aggressive force in this is is the U.S. in particular, and the NATO powers. And I guess I was wondering what we've really tried to stress is the way that the sort of the drive to war is coinciding with this effort to declare COVID endemic, to basically move on from the pandemic, under conditions where, as we've discussed, there's this massive social crisis, massive long-term debilitation, almost 1 million deaths in the US. And so they, the ruling class recognizes that there's this, social explosion that's brewing in the US. And so they're, seeking to sort of offset that by uniting the country around, war with Russia, or basically, So maybe if you could speak a bit on.
Well, I mean, I've noticed suddenly, like, my entire Twitter feed there's no COVID. It's all talking about war. So it definitely serves as a stellar distraction. And I think we can all agree that it is absolutely not the time to do this. But I remember all of the social cohesiveness that happened during like 9/11. One day you woke up and everyone had flag pins on their lapels and everyone was, rah, rah, and I think that, I think that would be a perk. I think that's how that's viewed, at least, as a distraction from COVID. And it's really a shame because, like, we should all be focusing on nothing but COVID at the moment. And so I think it's really unfair that this is happening. It's almost like there's just efforts to wear everyone down, just absolutely wear everyone down from every angle, to where people just, roll over and consent to whatever. It feels that way sometimes because it's just, hit after hit after hit and with no end in sight. So I definitely don't agree with war whatsoever. I don't. But I think, you're right. I think there's reasons for it. They would like everyone to look away.
They're trying to manufacture this basic fairy tale that COVID is gone, that it's endemic, that you don't need to worry about it. And it's obviously false, and it's the complete opposite of the objective conditions that millions, tens of millions, hundreds of millions of Americans and people all over the world are experiencing. And so they have to they're just in a state of deep crisis. What we've argued is that we have to oppose war. We're calling on the Russian working class, which has, if you look at The Economist, they estimate there's been 1.2 million excess deaths in Russia. It's experienced, even worse drops in life expectancy than the US. And, we're calling for the unity of the Russian working class with the Ukrainian, with the American, and, the European, to unite the international working class, to fight the real war that has to be fought, which is the war against, COVID-19, that we have to mobilize all of society's resources to put an end to the pandemic and to implement, global elimination.
Yes, I totally agree. I really wish that there was more of an emphasis on these long-term effects. Everyone is so laser focused on, I survived my COVID infection. It was just like a cold. We're hearing about this, like the immune system aging, and, all of these, just like you said, it was multi-systemic organ damage, it's only been 2 years, in the grand scheme of things, that is nothing. We have absolutely no idea what's coming. No idea. Especially if there's like the neurodegenerative issues, if, we could be looking at dementia, Parkinson's, Alzheimer's, like all of the premature deaths, and that's for the world's working class, and everyone will be affected by this. So mass infection, there's absolutely no upside to mass infection whatsoever. But I think as humans, it's hard for us to look at time like that. It's always now. Can't think of the future really, but I think the next 5 to 10 years, we're going to realize just how horrific this disease is, and wish that we had done things differently, for sure. So no, we shouldn't be focusing on war. We need to focus on eliminating this virus.
Yeah. Excellent. Okay, thank you so much, Laura, for participating in the Global Workers Inquest into the COVID-19 pandemic. Your testimony today has been really critical, and I'd encourage everyone watching to share this widely, and also to share the findings of the inquest as widely as possible. And if you'd like to participate in the inquest, please fill out the form below the video to share your experiences during the pandemic. We're really fighting to give voice to the working class and really bring forward and uncover the lies and the misinformation that have been really perpetrated on global society since the beginning of the pandemic, and really, as we've discussed today, really fight to educate the working class and to prepare workers to carry out the necessary struggles to end the pandemic, to fight for global elimination, and to stop the drive to war. So thank you again, Laura.
Thank you. Take care.
Okay. All right. Take care.